Thank you, Pam. I hope everyone had a nice lunch and had a chance to stretch the legs and catch up with new folks. I'm going to keep this brief because I know research is tough to get through, especially right after lunch, food coma, but hopefully just kind of introducing some concepts, sort of where the field is right now with exstrophy and research. Clicker's working, so we're winning. All right, no disclosures. So bladder exstrophy research, we've heard a lot this morning from different clinicians. We heard about some medical aspects, surgical aspects. We heard from patients, their perspectives, stories, and journeys. And I think research can be a really nice bridge for that. So I did a recent PubMed search. This is kind of where all our peer-reviewed articles and research lives. And I just put in the search term bladder exstrophy, and you can see there's over 3,000 papers out there that touch on bladder exstrophy from all different ones. And if you look over time, I don't really know what was being published in 1899, but you can see that, over the past few decades, it's really, exploded as far as, at least the amount of research. I think also the quality has really improved, which we'll get to later. So thinking back, in the 1980s, papers were saying, oh, here's this new approach, like Dr. Mitchell saying, I have this new idea about how we should be doing our first surgeries for bladder exstrophy. Here's my approach, the results from early surgery in, say, 5 patients. The 1990s research got a little bit better, and we started talking more about the different results. So, a few years out, how is Dr. Mitchell's closure different from a stage closure, and what are the kind of pros and cons? As we move forward to the 2000s, I think we're getting smarter as a community of researchers and starting to think about more of these long-term results, right? So not how do things look at 1 or 2 years, but about 5 years, 10 years, what's continence looking like? What's your renal function? How many surgeries are you needing and for what? And then over the past decade or so, I think we're finally moving into kind of that next phase of what I think is really important and what we heard a lot about this morning. What about adulthood, young adulthood, fertility, sexual function? And then most importantly, that's a term you may have all heard, and something I think that we all really need to focus on moving forward. Promise that too early. It just times out. Great. So as far as research challenges, so there are a lot of hurdles when it comes to research for something like bladder exstrophy. I think we all want to do a great job, but it's rare, right? So anytime you're doing a study, you usually have a pretty small cohort or group, so it's hard to make really strong conclusions based on that. Even a busy center might say, we've got a group of 20, 30, 40 patients, and here's how they're doing, but it's hard to say that whatever we're seeing in those 40 patients is going to apply to the international population. Also, different centers do different things, right? So results, when you read a paper, it's comparing apples to oranges a little bit. And then loss to follow-up. This is a term you probably have seen in a lot of papers, and that's just the nature of life, right? So you treat a patient when they're first born, you see them for the first few years, and you're really happy because they're doing great, but then they move away, and our medical records aren't perfect, and so you don't know what happened to them 5, 10, 15, 20 years later. So that's a real big gap in our research. And lastly, I think as clinicians and researchers, we kind of have tunnel vision, right? Like we spend so long training to be pediatric urologists and trying to perfect our surgical skills and techniques, but that's just a tiny piece of the puzzle. And so, the more advanced you get in your expertise, the more you kind of either forget or just don't think about all the other factors at play. And that's why involving colleagues like gynecologists or infectious disease experts, nephrologists, that's all really important. So getting back to patient-reported outcomes. So this kind of came up a little bit earlier, but this is how at least the FDA and the government kind of define patient-reported outcomes. Any report of the status of a patient's health condition that comes directly from the patient, without interpretation of the patient's response by a clinician or anyone else. And so this seems really straightforward, but it's actually not, because I think when we typically have done research in the past as a community, what we think is not actually what's happening. So I think Dr. Swargorian brought this up earlier, but when I'm working with students and residents, they'll go see a patient and then come back and tell me, so-and-so is doing great, they go to the bathroom and void every 2 hours, they're dry in between, and they're happy. We go back in together, ask a few more clarifying questions, and, kid is in pull-ups, and being dry means I'm not leaking through my pull-ups, so I don't have to change my clothes, and, that's how I'm managing. And so really understanding what's happening day to day. And I had the opportunity to go to Youth Rally a few years ago when I was in Seattle, and I remember sitting with a bunch of the teenage girls who were having a small group discussion about bladder health and talking about what they're doing for their drainage or ostomies and just sharing their experiences. And I remember one teenager, she was 17, telling me, I cath every so often, I've had a whole bunch of surgeries, but I'm really independent and I'm happy. But, I have to wear a pad, I leak, and, it's manageable, so I'm fine with it. But when I go see my doctor every summer, I tell him I'm totally dry because I don't want to have any more surgeries. So that doctor thinks their patient's totally dry and everything's perfect and this was the best surgery, but in reality, that's not what's happening every day. So with patient-reported outcomes, we're really trying to understand, on the bottom, clinical outcomes, right? So we want good health, we don't want complications, and then on the left, we want patient-reported outcomes, quality of life, what's happening day to day. And ideally, we're getting to that green dot where we're getting optimal health outcomes, optimal quality of life. That way, everyone's happy. And so I think Dr. McGarren brought this up earlier, but we had the opportunity a few years ago to partner with ABC to try to better understand what is really happening day to day. So this is Dr. Courtney Rowe. She was our fellow at the time and kind of spearheaded this. But what we aim to do is try to understand from adult males living with bladder exstrophy, kind of what were their outcomes when it comes to genital appearance and sexual function. So we, in partnership with Pam and her team, came up with a study design and used validated surveys. So this would be very consistent and not just sort of broad open-ended answers. And essentially found that the scores for penile perception and erectile function were lower than kind of the general population. And these respondents were about 30 years of age on average, and the vast majority responded they had at least 10 surgeries for their bladder exstrophy previously. 18% reported diagnosis of infertility. And then we asked the open-ended questions of what should we be looking for in future research? Urinary function, genital appearance, sexual function were the biggest themes that came across. And so, none of this result-wise may be super surprising, but I think what was really important about this study showed that we can reach a broad community, an international community, by partnering with a patient advocacy group. Responding to surveys about sensitive topics may not be easy, it might seem strange, right? You don't want to give away that kind of information, even if it is anonymous, but I think having a trusted partner probably made people a lot more likely to send in responses and participate. So we decided to basically do a similar study looking at outcomes in adult women with bladder exstrophy, also partnering with ABC. And again, Dr. Snorvorian kind of talked about the real results here, but again, the highlights of this were that we partnered with ABC, we could leverage technology by advertising this on social media and having people be able to participate from all over the world. We used patient-reported outcomes when it came to reproductive, sexual, and urinary function. So again, kind of standard validated surveys so that our responses could be replicated and could be understood and trusted by the research community. Of course, the results showed us, patients generally had a lot of previous surgeries. And what was interesting was that I think this is where the patient-reported outcomes are super important, right? If you look at historical papers, it'll tell you that, patients with complete repairs had 70 or 90% of, being totally dry, right? This was different. 38% are totally dry when they're asked independent of their providers around. So these numbers, I think, are a lot more reflective of what's happening day to day. And the topics for future research, again, Dr. Snorvorian showed us some of those, but Mental health and body image were big ones, and sexual dysfunction that came up. Those were the top 3 concerns for these adult women with bladder exstrophy. And the mental health and body image actually didn't come up as frequently in this study we did with the adult men. So, you know, different patients are gonna have different concerns, and I think it's really important that we're all aware. And so since we were able to do those studies partnering with ABC, we've seen more come out in the literature. So the top one was with the, I think the group at Hopkins, again, leveraging ABC and their community and technology to reach a broader audience. And then the one on the bottom right by Dr. Pippi Sally, who's part of the India Collaborative, did a very similar thing as well. And they partnered with the Exstrophy organization in Brazil. So, you know, I think we've come a long way since, you know, the 70s, 80s, as far as where we are with bladder exstrophy research, but we're definitely still not where we want to be. So I think we're finally using patient-reported outcomes, which is extremely important, but they're pretty well established for adults, but we don't have great patient-reported outcomes yet for children and adolescents. Right? And they're the ones who are going through all these, you know, average of 10 surgeries. So I think it's really important to hear from them and understand their needs. I think community voices are super important, right? So we're learning that mental health, body image are, you know, top priority for many of our patients. And so trying to be able to hear that and really listen, not only in clinic, but then, you know, with our research efforts, that's a big next step. Multi-institutional partnerships and registries, right? So we talked about how our group is relatively small at each center, and Dr. Krieger is going to talk a bit about this next, but, you know, we all have to work together to understand how we can serve everybody best. And I think thinking outside the box and outside of urology, again, we get that tunnel vision, right? So, you know, we're not thinking about other technologies that might be out there, you know, potentially in different fields of medicine that could be applicable to urology, or, you know, infectious disease, gynecology, or even just things that are not medical, right? I think, you know, we've seen in our work that the transition of care is a problem, and people don't know how to find adult providers. And, you know, the solution may not be something in the hospital. It might be working with Dr. Hadley Wood, and she is an expert in she has her community of adult providers who, you know, really want to care for this population. And so I think we just really need to think more broadly. And lastly, I think kind of evaluating the efficacy of interventions and solutions, right? So a lot of our research over the past decade has pointed out problems, you know, what's not going right, where do we need to do better? But then the next step is saying, well, what can we do to make that better? And I think that's really the next phase. And then this kind of goes to the above, being nimble, right? So, you know, again, not being stuck with your tunnel vision and knowing that if a new technology comes up, how does that apply to potentially, you know, this situation, or you know, what can I learn from someone else, and pivot and shift course as needed. So thanks for my quick spiel, and I think where we are with bladder exstrophy, I'm happy to take questions if anyone has them.